So I will go ahead and kick us off with mental health in children here. So this is a general overview. What we're seeing here in the United States, you can see on the left-hand side of this slide, the rate of mental health disorders in children, and it's organized by prevalence quadrants. So the states that are darker have a higher prevalence percentage versus the lighter states. But overall, what we're seeing is about a 16.5% of children in the US have at least one mental health disorder, which leads us to about 7.7 million children. Now, we imagine those numbers, and then you add the mental health stressors of a pandemic on top of that. So it's a public health crisis. You know, it's on the news. It's what everybody's talking about. If you go outside, you're seeing people in masks and socially isolating. That's definitely one stressor. And then, of course, we have social isolation. These children aren't going to school. They're not seeing family members, grandparents, cousins, friends. They're not getting that alone time that they get on the school bus or at school. And we certainly are aware of the economic decline that many people are facing right now. And that stress of an economic decline in a household can really trickle down to children in a way that can be quite stressful. What we have seen are increases in the rates of child abuse and neglect across the world during this pandemic. In China, the number of domestic violence reports actually tripled during this recent COVID-19 lockdown. And right here in the US, by the end of March, there was over a 20% increase in monthly calls to a sexual assault hotline, and it's from children under 18. So we're definitely seeing the effects of these stressors on children, at least as reflected by these data here. And historically, what we've seen is that children who are isolated or quarantined during something like a pandemic are much more likely to develop, mental health issues, mental health conditions like acute stress disorder, grief, adjustment disorder. Up to 30% actually met criteria for PTSD. So this type of pandemic, social isolation, it really can have effects on children. So Sara, I want to welcome you and open this up with a question for you. What are some of the common pandemic stressors that you're hearing about from children and parents in your clinical practice?
Hey, Nicole, thanks so much for the intro and the first question. I would say with children having to stay home, with adolescents having to stay home, first of all, they are missing out on so much of the socialization that is necessary for their developmental stage. And so many of the things that we consider normal parts of growing up, for example, sports, theater, those that are acting in plays, those that are a little bit older and attending homecoming or prom. Although these things may seem so minimal in the grand scheme of things, for an adolescent, these are huge moments in their life and something they've been looking forward to that really impacts them, especially when you look at the sports aspect, which is something we consider so greatly as a socialization and team building tool for kids as they're growing up to become team players, to become leaders, to become role models. A lot of the organizations and organized sports that are now canceled are impacting that. There are also the staying at home, with some of them with parents that are typically at work and maybe still are working. And so they are either left alone or under the care of a new caregiver, which can just kind of shake their world as well, especially if they're still trying to be homeschooled and complete projects at home. They don't have the typical support that they usually have. Go to the families where there are sibling groups of 3, 4, 5. I have a couple of patients that they are 1 out of 5 or 6 siblings, and that additional stress of 7 days a week, 24 hours a day, staying home with everyone, not being able to socialize in their normal social groups, but then also being restricted to a crowded house with typical sibling chaos can also be quite detrimental to their mental health. Lastly, you did mention the increased rates of abuse that are being noted at this time. While we talk about them staying home, that does mean that sometimes the abusers are also staying home. We know that individuals that experience any type of abuse, it's typically by a loved one or a family member. And so when you think about the cohabitating number that are cohabitating together and the risks that are increased as they're staying home, they aren't able to get out of their house. And not only that, they are not exposed to who would typically be the mandated reporters. They're not interacting with their teachers or their school counselors. And so if something does occur, it's less likely to be reported because there's no interaction with those mandated reporters.
Thank you, Sarah. It seems like so much has changed so quickly, and all of these changes certainly affect these children in many different ways. Thank you so much for your input there. I'll let you take us into the next slide here, reviewing some of the initial data and potential impacts to mental health.
Yeah, absolutely. And so we have been able to get a little bit of data in this short time. People are out there, researchers are out there really trying to get as much as they can so that instead of being reactive, we can provide some evidence-based interventions during this pandemic. So this first study here in the UK, quite a few participants looking at current mental health states and seeing how many of those increased or worsened. 83% having said that their conditions, their symptomology got worse. However, also another 1 out of 4 were less able to access mental health care, which I think we're going to talk about here in a little bit as well. Looking in China, who also, were the first to encounter this pandemic, have gotten into looking at over 2,000 students who also reported new symptomology. Almost 1 out of 4 reporting some symptoms of depression, about 1 out of 5 reporting new symptoms of anxiety. And when you look at why this is going on, yes, they're being isolated, but they're also being bombarded by all of this information, and they cannot necessarily understand all that's going on. And not every adult is willing and able to have those conversations with their kids about what is really going on. And so a lot of them are very worried about being infected with the virus, as well as thinking things aren't going to get better, that they don't have the hope because they aren't properly educated and given the information they need, and because their still developing brains aren't able to truly grasp all that is going on. And so I guess I would move forward with asking some of our panelists a question. We talk about these risk factors of being at home, being isolated from others, but also increased worry and decreased education about what's going on. I'd ask you, what are some of the risk factors that you feel you have noticed or that you perceive could be potentially impacting our children and adolescent populations during this time?
So I can start. I had a conversation with my 13-year-old when I was preparing for this webinar, and it was interesting because we haven't talked that much about what's kind of going on out there. But as I was getting ready for this, I said, what are you noticing in your friends? What's going on? What do you guys talk about? How's it affecting people? And one of the things that he said, and I haven't found any literature to support this is just from my kid talking to me. He said, you know, my friends who are really having a hard time are those that don't have siblings. Well, you said, too many siblings may be an issue, but for them, if they live in an area where they don't have anyone close by that they could kind of socially isolate with, if they don't have that, that's been difficult. And he's 13, so that may be a little bit specific to his age.
And Heather, I would have to agree with you since my daughter, she's the only child. She did report to me that, oftentimes she feel lonely. Luckily, she does have support from her cousin, who's also an only child, so they have been supporting each other. One of the things she has brought up, and I know the school district that she's in are trying to address, is some of the students might not have access to technology. Once school is closed, they have to return all the devices that was given to them when the schools were closed. And that could be a big issue when we think about the next 3 months during the summer. What are these kids going to do if they cannot see each other and there's no technology and they don't have a phone or even an iPad? This could create a big issue.
Thank you, Becky. Thank you, Heather. I think your statements definitely make sense. And for me, with two little ones, I think, you know, not having a place to go outside, not having a sibling in the house, I know for the younger age group has been a little bit tricky because then all of the entertainment, everything has been kind of laid on the parent. I feel lucky that although my two can get at each other's throats a little bit, being 5 and 2, at least, they have each other to play with at this point. So, Becky, you had mentioned what's going on in schools. If you can take us through the next slide talking about mental health services in schools, that would be great.
Absolutely, Nicole. And to start our conversation about mental health services in schools, I wanted to share with everyone the statement that was provided by a psychologist working with children in Hong Kong. So going to school had been a struggle for some children with depression prior to the pandemic, but at least they had school routines to stick with. Now that schools are closed, some lock themselves up inside their rooms for weeks, refusing to shower, eat, or leave their bed. And this statement is so relatable to me personally, since my teenage daughter, who have been out of school for the past few months, have also been exhibiting some of these behaviors. Countries in Asia was the first to be affected with the pandemic, and therefore their school system having closed longer than our system. And currently, research are being conducted looking at how the pandemic have affected our children, given that approximately 55 million students from kindergarten to 12th grade in the US are affected by school closures. And it's estimated learning loss of 9 to 12 months when they do return back to the school in the fall. School closure have also affected nearly 22 million students each day that depends on free or reduced price school lunch as a key source of their daily nutrition.